Hi, good afternoon, guys. Yeah, I'm shooting a video almost after 2 weeks. It's been that much time because my life is a roller coaster. Nothing goes as planned, but I just strive to keep it up and find as much as time possible to do all the multiple to-do list that I have. So, yeah, why the delay? Because just a short description of what's happening. So my mate went for her annual leave for a month, and I myself will be traveling to Mumbai somewhere around the first week of June for around 15 days. So till the time I'm going there, I've kept another temporary mate waiting for my own one to come back. So my 2-year-old son is having a ball with it. Basically, he's just refusing to accept her. He wants everything to be done by me. And that means I can't even go to bathroom without him banging on my door for even a minute. So that's my life. So I just send him to play on the third floor where there is a play area at the moment. So yeah, that's how my life is. He wants me to be there all the time with him. I can't take my phone. I can't shoot any video, and then I have to manage my clinic as well. So me and my husband are rotating shifts, and so it's going very, very hectic. Probably I'll be shooting at least 2 videos a day when I'm in Mumbai in my own home where my mom will be there and she'll be playing around with him. And I'll get some me time. Yeah. But, anyways, having said that, heart is full of love because as a working mother, there is always a guilt that when I'm going to the clinic, I cannot be with my son, but he couldn't care less. He's playing around, so it's okay. But yeah, as a working mother, you do feel that thing. So heart is very full of love, but physically you get exhausted because then you're all the time with him and you have to take care of everything with your stuff and home, work, etc. Blah blah. So, anyways, grateful for everything though. No complaints. Let's quickly start solving one of the other ADC questions. I want to finish off this mock, March 2023 paper and move on to the next one. This is the 13th question in the row. So, yeah, you will definitely get one of this question in your exam. It's based on either abrasion, erosion, or attrition, one of these kinds. Basically, loss of tooth structure, which is non-carious. Okay, so you need to know your basics with that. So let's go to the question directly. A 28-year-old man presented with lesions on his teeth and expressed concern about their appearance. Okay, so there is no pain as they have started to look unusual over the past few years. The patient reported a history of regularly drinking soft drinks means soda means acidic, brain, work your brain. But there were no significant concerns regarding his medical history or oral hygiene habits. He's seeking treatment for his teeth. Now, this kind of case can be present anywhere in the world, especially in a high stressful job or a patient who really likes to eat a lot of junk food, and junk food is accompanied always by some soft drinks around. So, yeah. And also, whenever you, in your own practice, I'm sure you must have seen teeth which are very, very clean like this, like a polished appearance, but the tooth loss has happened. And when they are so clean, that means the process is ongoing of the erosion. Now, if the same thing was present on the palatal surface, and not on the label surface, then your mind should have gone to gastroesophageal reflux disease, or the patient might be having bulimia nervosa because the acid comes when he tries to vomit. So if it's not present on the palatal surface, just on the label surface, and there is a history of soft drink, so you know what is the problem. So you see how the etiology is different when the same erosion is present palatally and it's present labally. So you must thoroughly check both the surfaces. Maybe both of them are existing at the same time. So, anyways, what is my diagnosis? Attrition due to parafunctional occlusion, erosion due to excessive soft drinks, abrasion due to incorrect brushing technique. Okay, now let's go back to this picture and the history. See, the history doesn't state anything about toothbrushing. So, and even if it was toothbrushing, it won't be affecting. You have seen abfraction, abrasion lesions, sorry, not abfraction. Abrasion lesions, they are more cervically than occlusally, and they don't affect like the entire tooth. Abrasion lesions are mostly limited to the class 5 areas. So I'm not going to go with abrasion here. Then we have attrition. Attrition means the all the occlusal surfaces, even the proximal for that matter. Okay, given the incisal edges though look treated, but not the other. I don't see the molars or the laterals or the canines. A bit maybe, but not so much. No, I'm not going to give attrition. Plus attrition, I would expect somewhere around 40 or 50s, not in a 28-year-old person. Erosion due to excessive soft drinks. Yep, yep. Most likely, I have the history. The patient is a regular soft drinker during work hours. So after work hours, maybe he's having, but that means he's having both during the work hours and after work hours. And given the history and it's happening since few years, a regular word is there, so I'm going to go with erosion here. The patient argued that he is using diet soft drink. How would you educate him? So you apparently must have told the patient you should not be having soft drinks, and the patient says, "Doctor, but I'm having a diet one. You know those diet colas, so which means less calories." So how are you going to educate him? Well, soda sweetened with artificial sweeteners does not cause dental erosion. You cannot say that. Properties of a beverage that define their likelihood to erode your teeth are related to acidity and what else is there here? Wait. Acidity and uh, I think the question was mentioning the buffering capacity. Why is it not showing here? Yep. It's acidity and its buffering capacity. Yep. So yeah, correct. And the third option is wait 10 minutes before brushing after consuming acidic foods or drinks. Okay, the first option is not true at all. That soda sweetened with artificial sweeteners does not cause dental erosion. That's false. The third option, wait 10 minutes before brushing after consuming acidic food or drinks. Maybe. But that is not going to reduce the effect of erosion because you have consumed the acidic drink. Now, the second option, that the ability of the soft drink to cause erosion is based on its buffering capacity and acidity, is the correct one because sweetened or not sweetened, if it's lowered your pH, and we all know that the tooth enamel starts dissolving at a pH of 5.5, and if something is lowering that pH of the saliva less than that, which the soft drinks and the acidic drinks do that, then even if there is no bacterial presence, the enamel would start dissolving either ways. So erosion is basically a dissolution of the enamel in absence of bacteria. Understood? So the B option is the right one. So you'll have to tell the patient that it doesn't matter, it's a diet drink or not, it has a sugary component to it or not. If it's acidic and it's creating the pH less than 5.5, your tooth is going to get destroyed. Simple as that. What is the best artificial sugar substitute? So now the patient might say, but I need to have sugar. So how would you give him that pleasure of having sugar without causing a tooth problem? Sucrose, oops, no. Sucrose is the arch criminal, you know that. Xylitol, yeah, xylitol chewing gums, why not? Glucose, uh, well, low on my priority list. Sorbitol, again, is chewing gum, sorbitols, once are there, not a bad idea. Stevia is also fine, but xylitol has been proven that if you consume that as a sweetener or you use that as a chewing gum, it will give you the taste of sweetness, and at the same time, it actually helps reduce caries because it does help in reducing Streptococcus mutans. I have given this in my explanation. So I'll go with xylitol because it's proven. If xylitol wasn't there, probably I would have chosen sorbitol. If that was also not there, then I would have chosen stevia. If that was also not there, then glucose, and at the last, sucrose. Like I would never choose sucrose, but this should be on my priority list. Understood? What is the most disadvantage regarding xylitol? Cost? No, you do with chewing gums. Same cost, I guess. It's like not a problem. Aggravate chronic disease and diarrhea. Okay, so this I myself had to Google up and read more about it. So apparently one of the side effects. Now this question you need to remember, memorize it, because even I did not know that one of the disadvantage that xylitol had been mentioned was diarrhea. So I've chosen that as an answer here. Now, what is the best statement? Which means the statement that is given, like the options. All of them might be true, okay? But which is the best one? Okay. Raw sugar is more natural and therefore more nutritious than brown sugar. Okay. Coconut sugar is regarded as being more natural. Okay. Dates are recommended replacement for sugar. No. Recommended sugar alternatives include syrups such as maple syrup or rice malt syrup. Definitely no. Limit our intake of free sugar to 6 teaspoons or 24 grams per day. If I was confused, I would be confused between, if I were to be confused rather, then it would be option A and E. Now I do know because I did study and I've given the explanations that we should be limiting our intake of free sugar to 6 teaspoons or 24 grams per day. Yeah, that is the correct answer. Mentioned in one of the articles that I was reading. And if this is not the option that would be given in the exam, then I would be choosing option A. Rest of the statements are not that accurate. So amongst all these options, option E is the best one. So I would be using that. So yeah, there it is. Read more about erosion. You will definitely get a question on this. Erosion, abrasion, abstraction, adhesion, parafunctional habits, bruxism. Okay. So I hope this is clear and you have understood. We'll try to shoot more videos. Need all the help that I want. It's exhausting. Like yesterday, I slept at like 9, like which is very early for me, but I was so tired. I just had finished my dinner. I slept at 9 and I woke up at like 6:30. In the middle, of course, 3, 4 times because my son was like rotating here and there, and sometimes he comes and sleeps on my arm, and at some point my shoulder starts to hurt, and I'm like, okay, let me turn. So yeah, parenting is going on. So yeah, I do realize that my parents must have also gone through this. And at times, I do feel like calling my mom and telling her, Mama, I'm sorry I put you all through this when I was a child. But somehow I'm not able to do that, okay? I feel she's going to roast me by laughing on me if I go and tell her that, Mama, I'm sorry if this has happened. Because she'll have a blast in roasting me by telling me, see, karma's back. Now you're having the same thing with your son. So I'm just going to keep my mouth shut and behave as if everything's normal and parenting is such a lovely job and I'm not going through tough times at all. So yeah, that is how the life is. Anyways, have a nice day, guys, and I hope I'm able to finish the last sub question of this mock soon. I hope I can shoot it tomorrow. So there, then I'll finish this mock 20, and then we'll move on to another mock, which would be, I guess, September 2023 exam, which just happened last year, or some other mock with another some good questions. Okay. So leave your comments. Your comments motivate me a lot. I don't share normally on my Insta or YouTube whatever comments you have written, but it really makes me feel nice when I read them. And I do reply. You all know if you have messaged me on YouTube or Insta or anywhere, I have replied. Or I just send that heart emoji because it's nice to talk. So, yeah, keep sending your comments and how your preparation is going on. Tell me your life stories. Good day. Bye bye.